At this onset, I would like to thank AIOS and Zeiss for giving me this opportunity. So today I'll be talking about EQ workflow for a toric patient. So all of us keep striving to be efficient to save time and indirectly save cost too. But what is efficiency? Efficiency is doing better what is already being done. So what is already being done is we've been using all manual markers, but the errors happen because of there's no reference point. Errors happen because of head tilt, cycle torsion, or sometimes when you excessively wash the cornea, then the markings go. As you all know, every 1 degree of misalignment of toric lens, we lose about 3% of its corrective effect. So when we use the routine 3-step technique of marking the toric, of marking the eye, first we mark the eye horizontally on the slit lamp. Then intraoperatively we mark 0-180 on the eye, and then also the marking of the desired axis of alignment of the toric lens. So when we use this technique with the bubble marker, we have found that the mean error of axis is about 2.48, and also the total error in toric IOL alignment is about 4.98. So is there something better? This is where the Callisto comes in. So basically, it is a markerless system. What it does is it gives an intraoperative reference point for you to align your lens, but it has other features also. It compensates for the cyclotorsion and gives you the right axis where you can create your incisions, your LRIs, and also do your capsular excess perfectly centered to the pupil or the limbus. And also it helps you in the toric alignment. So as you can see, I put a CTR in all my toric patients. As you can see, I'm doing it under irrigation. So once I've put the CTR, the trailing part, I hold it with a microforceps and put it into the bag. That way I'm rest assured it doesn't go into the sulcus. Now, why CTR? As you can see, there's a huge gap between the posterior capsule and the lens and the optic. This is one of the reasons why there is a higher chance of rotation during the early postoperative period. Now, when we implant a CTR, what happens is it expands the bag and brings the anterior posterior capsule closer together, thus increasing the contact between the optic and the bag. As you can see, this is a post-CTR implanted eye, where you can see a beautiful contact between the posterior capsule and the lens. It also has an automated tracking, so even if the patient moves his eye, the alignment or the reference points keep moving along with it. So this is how the overlay looks like, where you just have to align the toric lens according to the markings. Now, when we compare marker and markerless system, definitely I think in terms of quantity of vision, as Titi also rightly said, the quantity is similar, but definitely there is a significant increase in quality of vision, especially if you're going for a toric multifocal or trifocal lens. The patients will appreciate the difference between the two. And there are different studies stating the same. So now we have good hands and good machines. Is that enough? No, we need to connect them. And this should be a seamless connection. This is where the Zeiss EQ Workplace 1.6 comes into play. Basically, what it does is it seamlessly connects all the different machines in your hospital and brings it into one place. And it uses a platform called as Forum and connects all the plan. So in the clinic, so what we do is once we do the biometry, the IOL master data gets transferred into the online, and not just the biometric data, also the topography, the OCT, any DICOM machines, you can use it and upload it online. And this can be accessed from any computer from anywhere. Now, the first thing what you do is you need to log in and you need to customize your settings. That means first you can choose the formulas which you normally use, and also the IOLs which you normally use, and also the order quantity and also the emails you want to send your order to. So once you have done this, you don't need to keep repeating it, and it'll make sure that it follows the same routine. Now, coming to IOL selection. So once you have selected the IOL, you just have to add the IOL, and then you go ahead and then just go for the IOL order. Check everything and just press IOL order, and you're done, and you're good to go. You can also do your surgical planning. You can align your, where the lens should be aligned, your incisions and everything, and this you can transfer to your OT. Now, by chance, you are not able to do it during your work time. Let's say you have a long drive from your work to home. You can do it on your app on your phone. And while you're driving, you can just simply update all the data and do all the changes that needs to be done. Now, in the OT, when you select the lens, to confirm it is the right lens, you can use the same app. Once you scan it from your phone, and that way you'll make sure that you're not implanting the wrong lens, as you can see in the image here. So post-surgery, one of the very unique features, you can personalize your IOL constant sitting at home or sitting at your workplace. So for any IOL in your hands, what is the most optimum A constant? You can really customize it when you add the pre-op and post-op data, and also put in the post-op refraction, and that way you can really customize and tighten your post-op results. Now, does all of this actually improve efficiency, or is it just a gimmick? So we did a study where we looked at the time taken before and after EQ workplace. So this is how the workflow normally goes before the before EQ workplace in the macular system, where all the scans are done, the printouts are taken, usually the calculations done by the fellows or the junior surgeons, and it is given to the concerned surgeon. Now, if the surgeon's busy, it might take even 30 minutes to reach to him and get him signatures, and then maybe it goes to the store department and purchase order. So the time taken might range from 8 minutes 30 seconds to 62 minutes 30 seconds. Now, after the EQ workplace and the macular system, so the time taken is just about 55 seconds to 1 minute 22 seconds. Now let's look at the intraoperative workflow. As you can see, this is how the normal workflow goes on. Not much of changes, but the place where we actually save time is during the marking, and also during the surgery. The marking, what you save is about 30 seconds, and then 7 minutes during the marking. So total of about 7.5 minutes in the intraoperative period you save. But we usually do about 100 surgeries per day. So that means we save about 750 minutes, which is a significant time which we save. And especially when your OTs are really busy, this will really impact your efficiency and make sure that you're giving a good experience for your patients. Now let's get into the patient's shoes. As you all know, or we all want a patient workflow. We don't want a patient workflow to be long and inefficient. We want a patient workflow to be short and sweet. So likewise, so when we look at the patient workflow for a toric patient without EQ workplace and macular system, first, you have to instill a local anesthesia eye drops when you're working on the slit lamp. And this is not just once, you have to apply it once more during your surgery. As you all know, the local anesthesia is pretty toxic to the epithelium, and the more you apply, it'll damage the epithelium and you have punctate epithelial erosion, even though you've done a perfect surgery. Because of this, the patients will have a lot of discomfort, redness, watering, and also decreased vision on the day of surgery. But when we look at the patient workflow or a toric patient with EQ workplace and a macular system, there is absolutely no added step when you compare from a monofocal patient. You'd just be the same, and on the day of surgery, patient's so much more comfortable. He's so happy. His vision also is much better. So I'd like to conclude by saying we need to be efficient, not just at work, even in everything we do, even the smallest thing like brushing, or even when you're wearing your clothes. Keep thinking on the most efficient way of doing. That way, you're rest assured, no matter what you do, you're doing your best. Thank you for your time.
Thank you, Naren. Again,